pandemic affecting you and your organization?
Very similar to what Kamunya has said. One of the areas where we work is in schools. So Dandelion, supported by Pangea, has been working in 50 schools over the last 7 years. And one of the things that affected us and the communities in which we work is the closure of schools. So schools haven't been open since March this year, so close to a year. And then until yesterday, they said schools will be opened on Monday, but someone has gone to court to dispute that. Probably it might be opened in January. So what this has done is that in most communities and most households in our communities, schools are a safe space for girls specifically, from defilement, from sexual gender-based violence, from teenage pregnancies. Schools has been this, epitome where opportunity for education for kids is attained. But now for a full year, these kids are at home. So what we are beginning to see is the spike of teenage pregnancies. I don't know if you've seen this in the media abroad, but like just in our communities, only over 2,000 girls are pregnant already. So the challenges we are beginning to see is the fear that we will start having only boys' schools because a lot of girls will not be able to go back to school. That is one. Number two, a lot of people lost their employment. I'm not talking about the white collar jobs. I'm talking about even the general economic status at the community level. So if the men are not working and the women are not working, we're beginning to also see a scenario where we're going back to a level of poverty that wasn't there before. Because of the frustration, of course, then there is gender-based violence with women, physical, economic violence. And lastly, we are also seeing the issues of essential services, reproductive health services that are not a priority right now because there's a lot of COVID centers. Hospitals have been turned into COVID centers. So if a woman is walking 15 kilometers to a nearby facility to get immunization or deliver a baby and finds that center is closed, infant mortality and maternal mortality is now on the rise, including a spike in HIV infections. So these are just but the tip of what we're beginning to see at the community level. We can't even start to think about the secondary effects of COVID-19 at the community level. So yes, that is what we are seeing at the moment, Bob. Thank you.
Wow, that's a bunch. Michael, do you have anything you want to add in terms of specifics that challenges that you and the community are facing?
Yeah, really, just like Wendo said, I've noticed out of some of the challenges I mentioned about, being affected mentally, I've seen a rise, I've noticed a rise in issues of gender-based violence within the community. And especially men are feeling pressured to provide. They can't go home with empty hands. They have to put food on the table. And with a shrinking working space because of COVID, so, some people have been laid off their works. Those who do manual jobs, because the economy isn't thriving, are not able maybe to go work in factories or wherever. So they are not able to put food on the table. But then they still have to take something home, and therefore there's pressure between them and the family, the children and wives. And the only other way, in quotes, to deal with that is then get physical. And men are finding it difficult to deal with that. They don't know how to accept that they cannot go out there and work or earn a living as they used to before COVID.
Thank you. That's a really important thing. What do either of you see as the most important priorities that you are working on now as a consequence of the pandemic?
I think one of the priorities is to, personally, I feel people need to accept the way the situation is, that this is the new reality, that people, we have a pandemic with us and we have to deal with it. And then we have to adhere to the protocols. And there's been an interesting scenario here in Kenya. there's a good section of people who believe that COVID does not exist, that it's been a hoax. And I've been arguing that when the first case was announced, and you were asked to sanitize, maintain social distance, and wear masks, that helped to reduce the incidences of COVID. So now eventually when the numbers are down, people say that it does not exist. It's sort of a contradiction. But then if we stick to the protocols, then that's something that people need to be, to keep being told that we need to adhere to the protocols for us to reduce new infections. So then the other thing is to build that resilience. And if, as a people or governments or partners, we are able then to encourage people to build the resilience to deal with the pandemic, I think it would be something of a priority. Then also, like for my work, we've had to shift because we can't do physical theater as we used to before. We've had then now to shift to online content. So, but I realize, like, especially in my area, we have very poor internet connection. Even right now, I'm not sure whether you can all hear me well. But then therefore, then that affects our work. Sometimes, even when we put our content on social media, it doesn't reach everybody, especially in the rural areas. So those are areas that I feel are an area of priority, because for me, online content and technology is the future.
Terrific, thank you. Wendo, how about you?
The opportunities. One of the things I've noticed, Bob, is how grassroots organizations have really, I'm going to use the word shine for lack of a better word, because they are closer to the community. They, I think during COVID, grassroots organizations were able to respond faster. They were able to address essential services and take services closer to the people at a speedy rate than even the government did. So some of the opportunities I see are, I think that we need more investment in grassroots organizations. There's been this notion that grassroots organizations cannot be trusted because they are so small. But at the end of the day, it is the local, they deal with the local solutions. We don't come from a point of asking or telling people what to do, but asking them what is best for you. How do you want to solve this problem? So even when COVID came, the index case actually in Kajiado is one of the areas where we work in Masailand. And the question we started asking immediately was, what can we do as an organization? What do you community members want? And the first response was, can we train community health volunteers? Because they are the first responders. Majority of the community health volunteers are women. How are they going to be affected, being that they are caregivers, and the burden of being a caregiver, a woman, a community health volunteer, a mom, a wife, a sister? How is that going to affect the whole structure of the family? So I feel like some of the opportunities we see is, one, investment in grassroots organizations. Number two, even though we are grassroots, I think that it is time to invest in what Kamunya is talking about, the ICT platforms. Are grassroots organizations being given support to build their infrastructure, so that at a time like this, because this is not going to change now we're just going to move from Zoom to, I think the people are, the tech world people are working towards even a better platform. And I feel like if we don't evolve due to the lessons learned during COVID, then things are not going to be easy. So for me, the ICT aspect, ensuring that grassroots organizations are able to respond even faster. For example, like in Dandelion, we have what we call the backpack nurse model, where we take sexual reproductive health door to door, village to village, and just ensuring that every member of the community is able to be reached with service. So for me, those are some of the opportunities I see. Thank you.
Thank you very much for that thoughtful response. So we have maybe 3 or 4 minutes at the most to wrap up this part of it so that we can get to questions and answers from the group. Is there anything else that you, Wendo, or Michael would like us to know about either your situation or how COVID is affecting it?
Well, really for me, I just feel like society as a whole at this point in time, and not necessarily, in the rural areas or in the urban areas, not necessarily here in Africa or the rest of the world, society is just uptight. There's a lot of tension because of, I think I'd call it fear of the unknown in the future. And with that, I'm seeing a rise in, suicides, people just walking on the streets, talking to themselves, alone. And I personally, I don't know what that portends for the future. And well, they say artists are usually the last man standing. So for me, I feel like I've got work to do in terms of trying to learn what is it that then we can do as artists and, as a community to then create a better future for humanity with the advent of COVID, because this is not going anywhere anytime soon. So we have to learn to live with it. And we cannot have everybody just walking on the streets, committing suicide or talking to themselves without knowing what they're saying. So yeah, people have just got to come together and think about the future and how we will live the future with COVID.
Thank you. Wendo, anything else?
Yeah, so as you know, we have been working with Pangea for 7 years. And one of the things that we've been doing right from the beginning was creating opportunities for education for girls. But one of the things that it's like a pre-existing condition in our culture and in our communities all over the world is the lack of access to sanitary towels, which is an essential product. I find it weird that condoms are free, but sanitary pads are not. So some of the things that's going through my mind is how do we build programs, not necessarily programs, how do we support girls in totality, not just looking at their education, but looking at the barriers that affect them so that they're not attaining their full potential. That is one. Number two, I know that COVID has affected all of us in the world in one way or the other, whether it's the parents that you cannot go and see. And as Kamunya was saying, we are in our African culture, the handshake, the hugs, the hanging, like for us with the women meetings, and we are talking and drinking tea in people's homes, and looking into someone's eyes and really, feeling their energy and healing in that process. That's really been very difficult for all of us. But one of the things I want to say is that I know that we are all going through this together, one way or the other, whether it's Janet sitting in Cheryl's house, whether it's Alan sitting there trying to keep social distance and not coming to Kenya. We are all going through this together. And I feel like as a humanity, whatever even right now what's happening in the United States, it sometimes feels like it's hopeless. I think I've been to that place where I've felt, is the world coming to an end? The narrative being written about Africa, it's doomsday, and then it's Africa that's actually shown the world that we know what we are doing. We don't seem to know, but we actually do. And having faith that it's going to be okay. And even then, when it's so dark, the morning is still gonna come. So for me, those are the constant thoughts that are going through my mind when I talk to people, because it doesn't matter where I'm in a village or you're sitting in Seattle or wherever you are in the world, it's going to be okay in the end. Thank you.
Thank you so much. I'm sure we can hear some of the parallels in terms of the psychological dimensions, how pandemic is affecting. There are very, very strong parallels between there and here, as well as the economic, and then the other kinds of of things that you've described that are health related and social. So we're going to turn to questions from you all now. And Nick, do you want to say anything about how we're going to manage the actual talking here?
Yeah, so we have a couple options for questions. So you can just type them into the chat, as some folks have, or you can use the little raise your hand feature, or try to kind of get Bob's attention. I think because we have a queue of questions, maybe the best thing to do though would be, you can just write the word question in the chat so that we have a little bit of a queue. And I can see that we have a couple questions that have already popped into the chat. So the first one was from Betsy, and it's a question for Michael. Could you give an example of how you deliver content online?
Yeah, sure. Thank you, Betsy, for that question. Thanks to Pangea Giving, we are currently doing COVID awareness using theater, which ideally we ought to have been doing physically on open spaces in marketplaces and schools and colleges. But now we've had to shift that online, and we have our page, our Facebook page, Playmakers Theatre CBO. Maybe I'll type it on the chat. So Playmakers Theatre CBO, and on it we do Facebook Live videos, which run for about between 5 and 10 minutes, and then we're able to engage our audience in terms of how best then can we prevent ourselves, and how then can we also prevent others from getting infected with COVID. So that's an example of the kind of work we do. I'll just type on the chat the name of the organization, and then you can check on Facebook and see if you'll get to see what we do. Thank you.
Great, and then we also have a question from Alan there in the chat. And if anyone doesn't know how to use the chat or feels like that's not working for you, just wave your hand and we'll try to see you there, or use the reaction box where you can see that there's an opportunity to, you can clap or you can put your thumb up. We'll notice you that way. Okay. Alan, his question is the political class providing leadership, or has the pandemic become a divisive issue the way it is in the US? I've read that the doctors are on strike or may go on strike. Is that true?
I'll take the last question. Yes, the doctors have been on strike due to non-payments. So you can imagine the situation with some of the facilities at full capacity with COVID patients. And in rural settings where the major hospitals, what we call level 4, that had been converted into COVID centers, and the doctors not being there. So it is a catch-22 situation. We had a case recently, I don't know if it was highlighted in the international media, where a woman delivered outside a hospital in Pumwani, Nairobi, because of the same. It's shameful. So the things are not what they should be. Essential services are not being offered, but things are beginning to get back to sort of normal the last maybe week or so. But that is the situation. Essential services are not being provided, and organizations and hospitals like Dandelion Medical Center are at full capacity. I think we are almost doing 1,000 patients a month, and have had about 89 deliveries in just September. And that puts a lot of pressure on a small organization, of course, because we were not expecting that, nor does the budget allow, but you have to do what you have to do given the circumstances in which you are. When we talk about the politics, Kenya is very special. I feel like our leadership uses any means possible to be able to take away money from where it's supposed to go. So billions have been lost when it comes to COVID funds that were donated by World Health Organizations, and there's inquiries ongoing to figure out what actually happened to all the funds that were dedicated for this. So you'll find that in some hospitals, doctors don't have masks, but billions allocated for the same. So there's no proper leadership per se, but at the county level, people are doing what they can in their small clusters. And that's how we've been able to manage the situation. Thank you, Bob.
Mhm.
Uh,
Yeah, Michael, go ahead.
if I could add a bit on what Wendo has just said. Yeah, there have been challenges in terms of the political class and government providing proper leadership. But I must also say that they've been a bit proactive in terms of giving information. There are daily briefings on the COVID situation and how the numbers, whether they're rising or going down, and giving numbers by counties, which I think for me is a good thing, because then people are updated on what's happening. Yes, there have been challenges with the funds and loss of some of these products, PPEs and stuff like that, which affects the way the health practitioners work. But the biggest challenge for me has been actually politicians getting back out there. I think we have elections in about a year or 2 years' time, and politicians out there campaigning and just sending the wrong message that we can now all gather together, no social distance, no masks. In fact, some of them have been had to say that COVID is over now. We can now get back to our lives and just continue with our way of life. So we have politicians out there, doing campaign meetings and bringing thousands and thousands of people into their meetings without observing the protocols, which for me is quite a challenge.
So we have a parallel thing happening in the US. Is that negatively impacting things there in Kenya, or in terms of mirroring behavior here?
Yeah, I could say there is an effect, because then the message that gets to the public is that then we can just go on with life as it were. And my biggest worry is that then there's a likelihood that we could see numbers rising again, and we might just have to go back again to lockdowns and curfews and all that kind of thing, which then will negatively affect the economy and just bring everything down. Yeah.
Thank you. We have two questions here that are sort of related, so I'm going to read them in order, I think. Lynette to everyone, and then from Janet. Thank you for sharing your organization's Facebook page. Lynette says, besides COVID training content, do you also plan on creating additional uplifting and inspiring content to address people's spirit and mental health well-being at this time? And from Janet, Michael, you mentioned the importance of building resilience and encourage community members. How do you do this?
So yes, thank you,
Small question
Lynette.
for you, Michael.
Sorry?
Two small questions for you.
Okay, yeah, thank you for the questions, both Lynette and Janet. Yes, besides doing the COVID intervention skits on Facebook Live, we also do storytelling, and this we do in partnership with other artists within Nakuru and also internationally. Like, I'm involved in an online YouTube, a YouTube organization. They're called By the River. It's in India, and there's a lady I met in Egypt, and thanks to Alan, he supported me to attend. They're called PYE, Partners for Youth Empowerment, yeah, who use creative facilitation to reach out to young people in terms of mental health and such challenges. So I met this lady who's also a storyteller, and they run a project called By the River, and I've posted some of my stories there, which are actually meant to just lift up people's spirits in fighting COVID. We also have a YouTube page as Playmakers Theatre CBO, and we post skits, just for fun, not related to any main challenge per se, but just things that happen in life and how we deal with them, and they'll help people laugh. And for me, laughter is the best medicine.
Terrific. Wendo, do you have anything to add?
Not really. I think that for us, not just the community, but I think that our greatest asset is the team. We can't do much without a team that's healthy, that is grounded. So we really, I think this year we really invested in building the capacity of our team, ensuring that their mental health is okay. We have team buildings. We're going to communities together with the team. They come up. We have a very similar model with Kamunya when it comes to arts. So the youth peer providers come up with kids. We take them to the community level. We use that as a way to teach people about prevention of COVID and response mechanism for gender-based violence. So just creating an environment of positivity so that people don't feel like it's the end of the world. And that actually has helped our team really mature one. And I feel like they're at their peak of their performance, even during COVID, because they can see transformation within the community based on the work that they do. So yeah, thank you.
So are there any positive things that you can see that the context of the pandemic is doing in terms of innovating, in terms of trying on new things that you can imagine might be continued even after the pandemic is over?
Yes, a lot actually. So it's one of the things that we refuse to focus on is all the doom and gloom of COVID, from the political to the societal issues. One of the things that we have seen is you know, like we have table banking. So women have been buying motorbikes and doing door-to-door delivery, increasing their incomes and feeding their children. That is one. Number two, communities have really rallied and they are contributing food, whatever you have, so that we can be able to feed community members who have nothing at all. The other thing that is changing also is the online content. A lot of, we had this mentality that women in rural areas, you know, they have those small phones, the ones with a torch and nothing else. So a lot of women are taking loans to buy smartphones and learning how to use WhatsApp. And we are putting a lot of content on WhatsApp. They are creating music. That is where all the learning comes from. Clusters for reporting gender-based violence being done online by women who we thought and had assumed that they would not be able to use information technology. So those are some of the innovations that we are beginning to see. And I feel like going forward, it will also be an avenue for reaching more people in places we can't even go through ICT, as long as the infrastructure is there. Thank you.
Thanks, Wendo. And Michael?
For me, COVID has taught us one key message: to learn to wash our hands. How I pray that then we can continue just doing this forever and ever. I like an old man in my neighborhood who says, of course, in my native language, Kikuyu, that COVID fears soap and water. Yeah? So if we can find a way then of sustaining that and, you know, expanding wash services, you know, water and sanitation, you know, services within the community, even in just our households, that's one thing I'd like to see continue now and forever, not just because of COVID, but even for other health issues. Then the other thing, like Wendo mentioned, the question of, you know, online content, that has really opened my mind. I used to think that I'm only a stage theater actor, but I've realized I can also be very good on video. And another opening up situation is radio. And there's a radio, there's a community radio here in Nakuru that have become very innovative. They are using a special code provided by a telephone company where you can access their radio at I think three shillings for 24 hours, 3 Kenya shillings, yeah? And you can listen to the radio for 24 hours. And that becomes very handy, especially in rural areas where yes, people have may not have smartphones, but they have, just the ordinary small GPRS phone on which they can listen to radio. And we're actually planning with them to put up some of our content, which we've put online. We are converting that to radio theater, where then we can mobilize, radio listening groups, which Pangea is supporting. Thanks. So we are reaching out to the communities through those radio content through telephone, which is I think an innovation that needs to be expanded and sustained.
Great. Those are both good, three good things right there. Betsy, did you want to comment on the context in Mexico and how it might be similar or dissimilar from what you're hearing here?
Well, we have two guests from Mexico, but I just wanted to say, Wendo and Michael, such excellent comments. And Wendo, you said that there's an increase in violence against women now, which I think is happening all over. And I know that our partners in Oaxaca are experiencing the same thing, and they can speak to this better, but I think they are having to prioritize that work with women and leave on the side the work with men at this point a little more. Is that happening with you, Wendo?
Yeah, so I think for us from the beginning, and when we started working with Pangea, one of the things that we saw from the beginning was the engagement of boys and men. What has changed for us is the alternative justice system at the grassroots level, which is mainly men. So in as much as we are training and have formed gender-based violence networks at the community level, we are also, for us, we are prioritizing training not just women, but men, because women are not beating themselves. So we have to figure out what is it what is the ticking bomb, and how can men understand that GBVs will actually contribute to increase in HIV, to poverty, to all these things, and how can we as a community come together? So for us, we are working with both groups, and that's how we are beginning to see some significant change. Thanks for your question.
And I can't help but notice that in addition to our friends from Mexico, that we have a great Captain Sacco as part of our group. And I don't know you, great Captain Sacco, but where are you coming from? Nick, can you unmute him? You have to turn your mic on, great Captain Sacco. Well, that's not working. I can't hear you quite. Anybody able to help? So, great Captain Sacco, you have to turn your microphone on. We can't hear you. Now it's off. I'm sorry. Well, we're delighted you could join us, even if we cannot hear you. So does anyone else have a question that they would like to answer right now? Ask, rather. Statements.
Cheryl, I have a question.
Oh, Cheryl. Okay.
Yeah, about internet access. And, I was excited, but also scared that schools were going to maybe open in October. But I heard you say, Wendo, that now it might be January. What's the online situation? Assuming most students that your communities are working with don't have internet, is that right? Or computers? Do they just have a phone? Or I'm just kind of curious how they could access any kind of learning.
Thank you so much for that question. I think COVID has actually shown us how the gap between the rural child and the urban or peri-urban child. Whilst most kids, I think, in urban areas have access to online content, our rural kids don't have. They don't have that privilege. If parents don't have phones, then kids are not able to access. So a lot of kids, especially like in Mogotio and places we work, they've not been going to any school or getting any information apart from libraries. So some will come to the resource center. You'll find some with books, but majority are busy trying to survive. If parents don't have work, then the kids are out in, tomato plantation, sisal plantation, just trying to earn a living so that they too can contribute to supporting their family. So the education sector in rural communities has actually come to a complete standstill in most cases where I work.
Wendo, I have one more question. I was thinking about the youth peer providers, and not only knowing that they lead the groups and help support the Girls for Leaders, Boys for Change, but I remember visiting the center, and you had a little kind of a private little place where the youth could go and talk to one of the providers in a private way, and how important that was for them to talk about very serious issues, whether it was gender-based violence or unplanned pregnancy or whatever, early marriage. And I just wondered if the peer providers were able to continue to provide that kind of service, either, I don't know, by phone, or how they might be able to do that. They're just amazing young people. I was so impressed with them when I met them, and just wanted to know if you could say a little bit more about maybe that one-on-one work that they had done or are doing.
Thank you so much. I think one of the things that did not change so much for us, as I said, the investment on the team. So the youth peer providers, we currently, they continued to work at the community level, whether it was going, even during COVID, I think from April, even if it was going door to door to talk to young people about sexual reproductive health, observing social distances, we provided them with your support with masks, gloves, sanitizers, because we understood right from the beginning how urgent the need was going to be because of what we started seeing when the schools closed. They still provide services at the resource center, the youth-friendly service, sexual reproductive health services. And every Wednesday, all the Girls for Leaders, Boys for Change leaders in different sectors within Mogotio come to the center to receive help, whether it is mentorship, whether it is sexual reproductive health services, whether it is teenage pregnancies, issues that we have to address at this moment, whether it is FGM that is now rampant because girls are at home. So that has become a safe space for a lot of kids. And I think especially the last 2 months, over 600-700 people, young people have walked in through our door, which is challenging, but at the same time, we have to do what we have to do. So all they can do is wear masks, but we continue to provide the service, and the youth peer providers continue to do their job.
That's fantastic. Thank you.
Alan? Nick, Alan has a
So
question.
I have sort of an unformed question, but here we're so physically so far apart. We can't travel to see each other. And we have so much in common in going through this whole experience and trying to enduring it physically, emotionally. And I guess I'm just wondering if you have any thoughts about how can we support each other? What thoughts do you have about how we can better be of support to you, how you can better be of support to us? Very open-ended.
Well, for me, really, it's just constant sharing, because one thing I've realized is that COVID has made life become very dynamic. Every new day comes with new challenges, new dynamics, and I think the important thing would be just to keep sharing you know, what challenges we are going through and what ideas we have for, you know, meeting with those challenges, and, you know, where we have gaps. Because I realize what we planned last week isn't applicable this week. Like Wendo mentioned, 2 weeks ago, schools were to open beginning of October, mid-October. Then our president said, no, hold on a bit. We have to put plans in place for, you know, safety for children. And the general thought was that schools would open in January. Then again, we are told schools will open mid-October for certain classes, you know, those who are doing exams and that kind of thing. So things keep changing, and it becomes very difficult to then foretell what it is that would happen tomorrow. But I think that constant sharing would be key. And, you know, just opening wider channels for communication. That's what I think.
Mm-hmm. Thank you.
Wendo, would you like to add anything?
Yeah, thank you so much. I think when I met Alan 7 years ago, I used to think a donor was a computer. But yeah, so there was that fear of expectations, like how do I deal with this person? What can I say? Can I be my authentic self? Can I let them see my true self? When I call myself for a meeting, can I share my internal thoughts with my partner? But now, after all these years, I feel like one of the things that we can share is the common humanity and compassion. I feel like you're all here because you feel something and you're going through something that like we are. So it doesn't matter which part of the world we are in, we are going through this together. And I like what Kamunya was saying, that the open communication between all of us, just being honest and saying, look, this is not working and this is working better, and can we shift? And we as partners on the ground don't have to feel afraid to say when things are really thick, like, I can't do this, can you please help us? Or even for you, waking up at night and going like, I can't sleep, I'm so, you know, overwhelmed. And if you call Wendo, I'll tell you, come on, man, there's a woman who, you know, has 9 children and has no food. So just, you know, just hang in there, it's gonna be okay. Yeah, so I think the open communication, the trust, for me, communication has been everything, and hence the good relationship I've had with Pangea and the community at large. So that would be my prayer, and hang in there, it's gonna be okay.
Okay. Well, I think we're at our closing time at 9 o'clock. I want to thank Michael and Wendo and everyone who was involved in putting this together. I personally can say that I feel closeness again to you, Wendo, as we had time to share space together. Luckily, it was pre-COVID, so we could actually hug or shake hands. And Michael, I look forward to a chance for that with you. And anyone have a final word they'd like to say before we go?
Thank you.
Okay, thank you all.
Thank you.
Thank you so
Thank you
much.
all.